Welcome to the Dentist Show. Let's jump right in.
Welcome to the Dentist Show.
The Dentist Show.
We are here.
In Spokane.
We are back. Time to make it happen.
It's getting weird, guys.
It's getting weird. I don't even drink.
Yeah. Just LaCroix, right? Just getting sauced on LaCroix over here.
Just LaCroix.
Actually, we were talking about that
Sprite
a little
Zero.
bit. I would love to know what people think about this. If we were to give away like a gift or a prize for our
This is my long
our adult patients that come in and don't have cavities. You know, you go to pediatric office and they have that like cavity free sign and the little kid gets a picture and like a certificate or something. Okay. Kids love that shit. They love stickers. They love their picture and it's really inexpensive. What if we gave a gift to our cavity free adults?
This has been my thought for 3 years.
So you've been thinking about it for 3 years. Why don't you tell us what your top idea is right now that we can't get away from? Because I'm in.
You talking about the toys?
Oh no,
No. Okay. No.
we did
No,
say
I'm just kidding. We're talking about
no, but we did joke a little bit about a prize box for adults so they would like have like sex toys in there.
No, okay. How it went down. Okay, Ryan just went there. All I said is, like having adult toys.
Yeah.
Like a toy chest.
What are adult toys?
Like
anybody that hears the
you
word
took
adult
it there. I was just saying, I think it'd be an amazing idea. Actually, there's a practice in Scottsdale that already gives away, like they have a wine room where they have a waiting room and then you go through this little, it's like what's a secret back in the day? Like a secret
speakeasy?
bar. So they have a speakeasy. So you go into the speakeasy and you can wait for an appointment and drink some wine. But I thought
right before surgery.
Right. Yeah. Why not? It sounds, I don't know. I don't drink. Sounds good. But the other one, what I thought would be cool is cavity free club. And see, I think it's cool. I don't even drink, but you cavity free, you get a beer. it's always like, hey, congratulations. Here's a beer.
Yeah.
Or a Coke. Or here's a Coke. Get
or
a cavity.
Monster.
Get a Monster.
Or
here's
a dime bag. Or just
what's a dime bag?
like cocaine.
Oh, cocaine, dime. I got you now. Yeah, I thought it'd be so cool.
So
I
naive
want to make it
choice.
happen, but the problem is, how much is a can of beer?
Well,
$5?
I mean, yeah, it depends on what you're giving away. You can give away cheap beer for a couple bucks.
What's like a Bush Light?
Yeah, it's probably a couple $1 beer if you're giving away.
All right, so that's reasonable.
Well,
the
really,
gift has to be less than the kids' gifts are like $1 or less. Like we actually get them from trading. What's that place called? Trading something. Anyway, some
Chinese website.
Yeah, it's tradingsomething.com.
Yeah,
and it's like 50 cents or less per kid.
item.
But adult, so you don't want to be a lot because we don't make any money from hygiene. But
Well,
what I thought
especially if they're
would be
cavity free, we don't make any money.
yeah, so your hygiene visit's like already non-profitable. But man, when for 3 years, well, actually probably longer than that, I thought that'd be cool, and I just never pulled the trigger.
So, no adult toys, but beer.
It'll be adult toy,
Esque.
like
what if there's like a basket full of like adult toys, lube,
no,
gummies?
it's not appropriate. But like adult toys would be like, it's just so like what thing does an adult like that's less than a couple bucks?
Lube,
KY
toys.
jelly. You already have that in the offices.
We do.
Anyways, but that's my brainstorm because like all the offices
Yeah.
except one are fee for or PPO. So
the truth is, as soon as you said give away a free beer, that's all I think about now. I can't think of anything like that's a good idea.
I think that would be up here. I think down in Chandler actually too.
Oh yeah,
Could be a really good idea, but also I'm a Mormon.
Especially if you got a local beer though.
But I think you'd go viral. We are sharing some secrets that weren't supposed to get out. Ryan, this was my mastermind idea.
Okay,
And I was
but
gonna
isn't
trademark
it about to share with people? Like, you can't trademark giving away free beer at your dental office. You're not Paris Hilton. You
Cavity
can't.
Club beer? Cavity free club beer.
Yeah, that's a tagline right there.
But I think, and the caveat is if you take the beer, you gotta take a selfie. And I think a lot of people do it.
And you have to prove you're 21, obviously.
Yeah, I mean we'll be able to lose. But yeah, you can do a Truly. Was that the girl drink? What? Probably what you would like. Truly or the White Claw.
White Claws.
Isn't the White Claw kind of like they're white trashy?
I mean, I don't know. Do you,
I think that's kind of, but the Truly's like the
little
girly
nicer?
drinky, and then you could do like the glass of wine, but it's cheap wine because it's
like
gotta be
box
a couple
wine.
bucks. No, there's like a cup of wine.
Like the little pods.
Yeah,
Yeah.
I saw it on Shark Tank. Anyways,
They make little like 6 ounces of wine in a can.
That sounds like that'd be gross. But I think, and maybe it is. If a can, because a can of Coke's like 50 cents, so maybe a can of beer's $2. It might be. It could be fun, and the point is like have fun and
It would stand out.
it would stand out. People would post it, and I think it'd be cool. I think, and someone asked me like, "Well, don't you have to have a liquor license?" And I kind of looked into it. No, it's free. We're not selling it.
Yeah, you're just giving it away.
We already paid the tax to the store that we bought it from. Anyways, that's a deep thought. That was my secret.
So,
But
you're
not-
all about helping patients.
Now my
with,
10 people, my
with,
10 followers know about it.
Yeah, now that you're willing to help people with their cavity-free beers. What are some other things that could help make us stand out? Like you were saying something about like 10 function, 10 aesthetics.
Our case acceptance or
What's our case acceptance?
what I've
like?
switched it up, and what we're going to try to teach doctors. I have a hard time getting doctors to stop talking about treatment,
like dentistry in general.
Yeah, they just want to talk about all the many options.
Yeah,
and I do too. And I think I said it before on the podcast. A really good salesperson makes it really simple. I think a really good dentist makes dentistry really simple, and the patient's going to listen to what we suggest anyways. I think ultimately, if there is not a budget concern, the patient's going to listen to us for the best option.
Yeah.
If there is a budget concern, the patient's going to listen to us for the best option for their budget. Like, they're still going to ask what we want.
Yeah, the best option.
I've been pretty clear on this podcast. I really think you're not a great dentist if you give a patient 3 options.
Yeah, I agree with that.
I mean, you can discuss the options, and then before you leave, unless if it's a 1 implant versus 1 bridge, and they want to know within a couple $100 what the difference is. I get that. Or if some insurances don't pay for implants, they pay for bridges. I get that. And most of the patients don't really care what the other treatment is. They just want to know what's best for them.
Yeah. So what's the best outcome?
Yeah.
For
So
that?
how I think we're going to go about it.
Yeah.
How I've been practicing lately, practicing my words. When it's a bigger case, I say, for your smile, let's just talk about your smile. Would you want a 10 out of 10 smile as your final outcome? Or are you okay if it's a 5 out of 10 or like a 2 out of 10? And that sets the expectations because I have all those. I have those options. And most patients will say, no, I really want a 10 out of 10. And then some guys are like, I find what I have now. Yeah. It's 2 out of 10. Totally fine.
Do you tell them that? When they say, I find what I have now, you say, oh, you're like a 1 out of 10.
I don't. And how impactful would that be if you did?
Okay, so you're like a 2 out of 10. Cool. We can make that happen. I'm going to try it. I'm going to give it a go.
I think that's a new way.
That's a new.
Okay. So you say, okay, do you want a 10 out of 10 smile? Because right now you're a 2.
No. Leave it like that. Be like a 10 out of 10, a 5 out of 10, or like a 1 out of 10. What do you want? And they're like, well, I really want to just have what I have. And
Gotcha, 1 out of 10.
Yeah, so you'd be like, cool. Manny, can you write that down? He wants a 2 out of 10.
Has 1 out of 10.
Can we give him sign the consent? He wants 2 out of 10.
You know what was impactful? There's one of our offices generally has a higher case acceptance than all the others. Christy was telling me like, oh, the doctors are mean here. And I was like, what do you mean? She said, well, the doctor, someone broke number 5 or 6. I think it was 5. So she gave over the options of a bridge and implant. And the patient said, I don't think I'm going to replace it. And the doctor's like, ooh, you're going to have a space in your smile? You're going to missing tooth? Like, that's what you want? And she's like, well, no, like, then fix your tooth. Like, and it's like so simple.
Yeah, it's like, if you don't want the hole, fix the tooth.
Yeah, like, is that in your smile? Yeah, that's in your smile. Anyways, so I do 10 out of 10. Do you want a 10 out of 10 smile? Yeah, that's important to me. Great. Okay, now we have to go to function. Now, do you want a 10 out of 10 function, a 5 out of 5 function or 5 out of 10 function or 2 out of 10 function. And
I snorted a little bit.
they said that
I want a 5 out of 5 instead of a 5.
I want 10 out of 10. I want 5 out of 5. 5 out of 10 smile or a 2 out of 10 smile. And now that sets the precedent. Like, I have those options.
Yeah.
I can give you in a full, if you're talking about a full arch case, I can give you a 10 out of 10 smile and a 10 out of 10 function by doing an all on X. I can do a 10 out of 10 smile and a 2 out of 10 function with a denture.
Yeah.
I can do, and between that, I have options too. And I had this conversation actually on Monday where a patient came in for a consult for an upper and lower all in 4, all in X. And I did this because I said, the top teeth, they need to go. We're all in agreement.
Yeah.
And she says, okay, 10 out of 10, 10 out of 10 function. I'm like, okay, the bottom ones, we can fix them. So we can do veneers on them. We can do some part, so we can do, we should probably have to go to the periodontist. But we talked about that. And she says, no, I want a 10 out of 10 smile and a 10 out of 10 function on the bottom too. And I'm not saving my teeth. Because I said, we can get you there by saving your teeth. And she said, no, I do not want, okay, that's fine. In this case, it was reasonable.
Yeah.
I won't do if it's not reasonable. And so she started speaking the same language.
Yeah.
So we're on the same page. I found when I do that, I can stop talking about treatment. We're talking about outcomes.
Yeah.
Because you tell me what you want as far as the outcome, and we can speak the same language. It's way easier now to come up with a treatment to get the outcome that they want.
Yeah. I think you just said it right there. Now we can speak the same language.
Yeah.
Right. And I think that's like, I actually didn't click until now. Right. When you said that, it's like, even when we dumb down our dentistry, it's like a foreign language to most of our patients.
Yeah, partial denture. Do you want something that comes in and out of your mouth? They say yes. Then you deliver the partial.
Yeah. And they're like,
wait, it's moving.
yeah.
Yeah.
It's got to come in and out.
It moves. But now I say the partial denture is going to move all around. Anytime you eat, it's going to move. Are you okay with that? And it's not going to move a lot. It's going to move a little bit.
Yeah.
And it comes in and out. But now I can just say, do you want a function of 2 out of 10?
Yeah.
That's the partial. Well, let's say partial is like probably like a 4 out of 10.
Yeah.
But
Maybe.
denture is like a 2 out of 10. But it sets the expectation of what that's going to be.
Yeah.
And we talked about the 10 and 10 options. You didn't want them.
Yeah.
So now we were okay.
Now
You're
you're
sacrificing that. Now you're going to get a partial. And like we even use terms like, oh, well, when you get denture, it's like 20% of your chewing
Function,
power
yeah.
or function. That's good. 2 out of 10 is way easier to say.
I'm glad you brought it up because we actually have a flyer
Yeah.
that we use for our all on X cases, and it
Yeah.
says 95% function, 80% function and aesthetics, and then 50%. And I think that means something to patients, but 5 out of 10 means way more
Yeah.
than 50%.
Yeah. Yeah. To
And
me,
it means
does
the
too.
same thing.
Yeah, I think it's just easier to wrap your head around.
Yeah, it's like, oh, so 5 plus 5 is 10, half. Okay, that makes sense. Like I know it sounds dumb, but we're already talking about stuff that they don't fully understand. So let's give them let's make it as easy as possible for them.
And I think if you are a dentist or you have dentists that work with you that have that engineer mind, that love data, this is one way you can help them and help yourself. Just talk a little less.
Yeah.
Because once you get the response of what they want, then you can dive into the treatment a little bit. Like, this is what we're doing to get you that 10 out of 10, 10 out of 10 function. And that sometimes is keeping teeth, is sometimes taking teeth out, sometimes implants, sometimes bridges, all kinds of options. So
Wait, there's more options than just one?
yeah, unless you go to, I already dropped another corporate name, but Clear Choice.
Oh,
So you get one option.
all arch.
Yeah. Actually, there's a lot.
Temporaries.
Actually, you guys know there's like these all on X's like clinics popping up. They do like 200 cases and they just close down.
Yeah.
It's like the new corporate money.
Just pop in, make
Pop
a ton
out,
of money, and
no
pop
warranty, nothing. Just banning patients. Maybe that's just an Arizona thing because non-dentists can own
out. You want to
practices.
try it up here in Arizona and see how it works?
Up in
Or up in
Spokane.
Spokane?
God, I just can't believe it.
That's
That drives me
too
crazy.
bad.
Anyways, I don't like people all that do that at all.
Well, do you want to throw the owner of Clear Choice under too? What's
They
his name?
sold to some DSO.
Oh, did they? Okay. Anyway, I think that's super powerful.
Yeah, I
that-
think you true, and you got to practice it. You have to practice. Like even the first time I started using it, it's awkward, and you keep practicing. And like the first time, I think they just kind of stared at me. The second, third, fourth, fifth time, now they're starting to like use it with me.
Yeah.
And maybe it's because I'm like more patient with them.
Well, and you're more confident in what you're saying.
Yeah, because it makes more sense to me. And then now it makes more sense to them. So you can try that. That's a good little, that's a thing we actually learned. We'll give them credit to the Progressive Marketing Company. It's probably the only thing I learned. Just kidding. I think we had a podcast. I learned a couple things.
Yeah.
But that's one, outcome-based talking,
Yeah.
not treatment.
Yeah, and I think when we were having a conversation about some of our providers in our offices and what some of our team sees as why they're so effective at what they do. And when they're talking about one of our doctors, they're like, he's just direct. He just says this is what we can do.
Yeah.
And that's it.
Yeah. Yeah.
And I think this is the version of that we can hopefully enroll everybody in.
Yeah, and think about we had a few doctors that really have a hard time with confidence and deciding what's best for the patients. How much easier would it be if they know the outcome? Like the option is they're okay with a 5 out of 10 smile, but they really want a 10 out of 10 function.
Mm-hmm.
Well, that gives you one option to really dive into.
Yeah.
Or they want a 10 out of 10 smile, but they don't care about function. That just opens the door to like dive into the treatment that best fits that patient. It's so much easier. So you just have patients or doctors that do not have the best confidence. I think it'd be way easier to. So instead of trying to dictate what's best to the patient, you help the patient decide the outcome. You just do the treatment to get them there.
Wouldn't you say enroll the patient in treatment?
Enrollment.
It's all about enrollment.
Enrollment. It's way easier to have the patient decide the outcome than you.
Yeah. And you help them come to the outcome that's best for them because you're the expert in what you do.
Yeah. If they say they want 10 out of 10 smile, 10 out of 10 function, it's like, okay, it's $30,000, $40,000, $50,000.
Right.
Like, okay. No. Okay, which one do you want to make a sacrifice on?
Yeah.
Do it smile, function, both, a little both, all of one, none of the other. Like, anyways, I think it's a great way, and maybe your way is better too. And if it is, then let us know by comment section or emailing me. If you can do something on the
You can email
website.
us at the Dentist Show.
Chase at the Dentist Show.
Yes, Chase at the Dentist Show.
I check that once a week. The website, I don't know. If you guys done anything to the website, sorry.
We're still learning.
Yeah,
We're still learning.
You might get a PDF one day when I go get all the names.
All right. Well, that was another episode of the Dentist Show.
Yeah,
Please let us know what you thought by either listening or not. So if you liked what you heard, keep listening. If you didn't, don't torture yourself.
Hopefully something's hitting something sometime. It's just, hopefully it helps.
You're rambling, dude.
Yeah.
It's helping. Keep listening.
And share it with some friends. We want to get some cool podcasters on here with us.
Yeah, we've talked to a few people.
Yeah, I think we're going to cut a couple on so you don't have to hear us rambling as much.
Yeah. So more to come, and thanks for listening.
All right, thanks, guys.
Thanks for listening to The Dentist Show. We hope that this episode helped you make smiles about more than teeth. To get more resources to grow as a dentist and to learn more about Chase and Ryan, go to thedentistshow.com or just follow the link in the show notes. If you enjoyed this episode, share with another dentist in your life and help us grow the movement. And be sure to rate and review wherever you're listening.